Hi, everybody. This is Lee, and once again, I'm talking about single payer health care, Medicare for all. John Conyer's bill that he introduced into the House, H.R. 676. And he introduced it on January 24th, and right away, about 51 representatives signed on to co sponsor and still waiting for more to get on board. There was a national calling campaign by Healthcare Now to get more people on board on the day after it was introduced, January 25th. And I think they succeeded in persuading about 10 more representatives to sign on to the Medicare for All bill. But there needs to be more. Personally, as far as I'm concerned, anyone who fails to co sponsor that bill in the House of Representatives, anyone in the United States, feel free to primary them in 2018. If they do not sign on to co sponsor that bill, feel free to primary them. I support that wholeheartedly, and I believe that it should be done. But before I get into lecture mode, I'm gonna actually talk more about the bill. There's a summary at written by the Congressional Record Service (CRS), and so I'm gonna explain exactly what the bill is, and then link to it, of course, so people can see what's going on with it right now. So this is H.R. 676, introduced into the 115th Congress on January 24th, 2017. And so it's the Expanded and Improved Medicare for All Act. It's been introduced into the House for years. Every few years, John Conyers reintroduces this bill. So it's not new. But the fact that we're very much talking about healthcare now, that there's a change and, crisis, which is also viewed as opportunity to actually bring Medicare for all into the discussion. Right now, people are squabbling and expending a lot of energy talking about the Obamacare, the Affordable Care Act, which is a flawed product that people are squabbling over when there's a superior product available. Okay, and so this bill establishes the Medicare for All program to provide all individuals residing in the United States and the U.S. territories with free health care that includes all medically necessary care, such as primary care and prevention, dietary and nutritional therapies, prescription drugs, emergency care, long term care, mental health services, dental services, and vision care. And so right now we have people over 65 who benefit from this program already. We have people in Libby, Montana who benefit from this program regardless of age. So we have pockets of people who have the benefit of Medicare for all. And it's based on providing the very most best care for the least amount of cost, security, and a safety net, so people don't have to worry about mortgaging their homes in case chronic or terminal illness comes up that needs maintenance. And many people view healthcare as a public good because it's public health. And when the public is healthy, the public is healthy, rather than some people are healthy and everyone else is sick, because eventually everyone gets sick. That has a way of communicating around the community, being spread. And so a healthy public is a safe and secure public. And many people view it like education being a public good that should not be privatized, with police and fire emergency services that should not be privatized, with roads and bridges and schools that should not be privatized, that they are public goods like parks that everyone should have the benefit for and from and use and have equal usage of. And so the public supports it. And so they're saying that healthcare is a public good. And many nations, modern civilized Western nations, do view healthcare that way as a public good. So I'll get back into this. Only public or nonprofit institutions may participate in this Medicare for All Act. Nonprofit health maintenance organizations, HMOs, that deliver care in their own facilities may participate. Patients may choose from participating physicians and institutions. Health insurers may not sell health insurance that duplicates the benefits provided under this bill. Insurers may sell benefits that are not medically necessary, such as cosmetic surgery benefits. And so that actually does go a long way to regulating and possibly, for the most part, eliminating profiteering from insurance companies on sickness and illness and death. That they may not bogart their way into providing health care, that they only provide supplemental care or elective care, and that the services that are not covered by the Medicare for All Act. The program is funded, one, from existing sources of government revenues for healthcare, two, by increasing personal income taxes on the top 5% of income earners, three, by instituting a progressive excise tax on payroll and self-employment income, four, by instituting a tax on unearned income, and five, by instituting a tax on stock and bond transactions. Amounts that would have been appropriated for federal public health care programs, including Medicare, Medicaid, and the Children's Health Insurance Program, are transferred and appropriated to carry out this bill. So it's basically paid for with existing funds. Funds that are going to parts of the Affordable Care Act that fund that would be transferred to this Medicare for All, and that there will be an increase in income taxes on the top 5% of income earners, so not the middle class, not the working class, not the poor, but the Warren Buffett types, the Mark Zuckerberg types, the Bill Gates types. They would get an increase in their taxes in order to provide health care for the bottom 99%. But not, in addition to that, there would be a progressive tax on payroll, meaning that rather than paying all those high premiums that get taken out of your paycheck if you enroll in an insurance program through your employer, rather than that high premium, there would be a smaller tax added to the tax on the 5%, rather than the deductible being used, rather than the premiums, rather than the out-of-pocket expense. This would be taken care of in a more equitable way that doesn't break a family's budget or put them in the streets, or hurt their paycheck too much. And so, a small tax versus a high premium, what's the problem? And then, let's see, instituting a tax on unearned income and instituting a tax on stock and bond transactions. So actually what Bernie Sanders suggested, that those Wall Street transactions that get done on the trading floor, there's a tax. Everyone pays a house a slice, whether you're in Vegas or wherever, you slice off a little bit, a little something for the house. And so there would be a slice taken off Wall Street transactions that would be used to pay for this health care. And so that's how it's paid for under this act as it is. The program must give employment transition benefits and first priority in retraining and job placement to individuals whose jobs are eliminated due to reduced clerical and administrative work under this bill. And so, with the elimination of the insurance profiteering, the middleman, the administrative and operational costs, such as with Blue Cross and Blue Shield and Humana and Aetna and all these large, very extremely expanded health insurance industries that have kind of gotten to gargantuan size underneath the Affordable Care Act. There's going to be some job loss because going direct with a single payer, there's no need to pay for these high operation costs. And that's what lowers the cost of the insurance anyway. But, some people will be out of work, but they will be given transition benefits and priority in retraining and job placement, maybe into a similar or different industry. But that's part of the reason why it's not going to cost as much as the Affordable Care Act. There will be less administrative fees. The Department of Health and Human Services must create a confidential electronic patient record system. The bill establishes a national board of universal quality and access to provide advice on quality, access, and affordability. The Indian Health Service must be integrated into the program after 5 years. And right now, that's where the bill is in the Congress. It's been referred. And I think this is the reason why there's got to be some kind of evaluation about the Indian Health Service. Congress must evaluate the continued independence of Department of Veteran Affairs health programs. And so there'll be a link to the summary. You can read it at your leisure and get a understanding, hopefully avoiding the propaganda of people saying, well, this is communism and Putin wants us to have single payer, so we don't want it. If you read the summary, it tells you what it is. Don't ask Paul Ryan to tell you what it is. Don't even ask Donald Trump to tell you what it is. Read it for yourself, please, everyone, so you can know what it is and what it's supposed to do. Again, just to summarize, there actually, and this is from the Healthcare Now website, there is no GOP replacement plan for the Affordable Care Act that wouldn't result in millions of people losing care. The HSA, the health savings account, the tax credit, the maybe pre-existing coverage, maybe not, children 26 and younger coverage, maybe not. There's a lot of people who are going to find themselves, and then the high risk pools too, and how they're treated, how they're ghettoized in one area, and then perhaps they have to pay a higher premium than everyone else. The sickest people will be the most financially hit. So, I mean, sickness is not voluntary, but, it's how you look at it. HR 676 is the only plan that would actually cover everyone and save money. HR 676 is the only fiscally responsible way to cover everyone and would bring healthcare costs down by reducing administrative waste and profit. And so again, eliminating the insurance companies saying that they cannot be part of this program, that they can offer supplemental coverage or offer like elective, for elective procedures, they can cover that. That's the role of the insurance companies. And so basically the costs would go down because there would be no profiteering by the insurance companies on required care. And, actually spreading out the cost amongst millions of people rather than setting up these small pools. And it seems like it would just actually be a small tax on everyone rather than a devastating effect of judgment and punishment on a few who are more sick than others, like our elderly. So it would just spread out the cost amongst a lot of people. So, okay. So I'm going to look at the status of HR 676 because I said that whoever's not co-sponsoring this in the House, I say feel free, entirely free to primary them in 2018. They should have a primary opponent. If you are progressive and you believe in universal health care, that health care is a public good and that everyone should be healthy for the good of our society, that they should be primary. And so I'm looking at the list of congressmen who have already signed on, and I'm pleased to see that most of the Congressional Black Caucus has signed on, including some that I've had doubts about in the past. They're on here, and I'll just let people review the list themselves. And then also people who are Bernie leaning have signed on. So progressives, and then who lean towards Bernie, and then also Congressional Black Caucus. And it looks like, again, that's not everyone. It should be, for my, I feel it should be the whole House. I mean, seriously. But let's see. There's 12 representatives from California. That leaves a lot that have not signed on. There's 7 from New York. Again, there's many representatives lacking. And then 3 from Ohio, 3 from Pennsylvania, and then it goes down from there, 2 from Georgia, 2 from Maryland, 2 from Massachusetts. So I'll let you review the list, and you can see in your state who has signed on, and then you can figure out who's lacking if that's your representative. And you might want to give them a call. You might want to, follow that indivisible script and show up with a Medicare for All sign, or even a sign that says support HR 676. People are playing games right now. They're playing games, playing footsie with Obamacare and the Affordable Care Act, making a lot of noise about that, being very quiet that there is actually this bill, this Medicare for All, which is actually a superior product and harder to argue against. And so the reason why they're not speaking about it too much in the media is it seems like the more people learn about it, the more people like it and want it. And so it's being kept hush hush. Similar to the way that Bernie Sanders was kept hush hush, because the more people learned about him, the more people wanted him to be the president. And so the media kind of kept him hush hush until people discovered, oh no, that that's another story. But anyway, this is more about Medicare for All, that it's entirely doable, it's entirely practical, it's entirely ethical, and it's entirely moral, and it's entirely affordable. Once people actually read the bill for themselves and understand what it is, and stops letting people rent space in their head with the propaganda that, one, it can't be done, 2, healthcare should be free market based, and the power, the power should be put in the hands of the free market rather than the government. But the government is we the people. Actually, putting healthcare in the hands of the government is putting healthcare in the hands of we the people. It's our healthcare. It's Medicare for all of us. And so, Paul Ryan is trying to say, well, we don't want government to have control over healthcare. What he is actually saying is he doesn't want we, you, me, us, all to have control over healthcare. He wants Blue Cross and Blue Shield to have control over healthcare. How do I know that? Because Blue Cross and Blue Shield are one of his top 20 donors on his campaigns to get him in and keep him in the House. and that he met with them prior to releasing his own plan. And for all I know, they wrote it for him. And then he said Paul Ryan at the top and, released it. And so, lean to your own understanding. Get Paul Ryan out of your head and read what it is for yourself. After you read it, then make a decision on whether you want to hold up a Medicare for all sign or an Obamacare sign. I'm sure after you read this, you'll prefer Medicare for all. Certainly more than Ryan Care. I'm just saying. Good luck.